My name's Sara David and I'm a midwife from Perth, Western Australia. And in 2012 I was invited by men in remote villages of Papua New Guinea through the Churches of Christ to give some training to their village birth attendants because of the very high maternal mortality rates due to a lack of health services in the area. The maternal mortality rate in PNG is 733 per 100,000, and in the really remote areas it's as high as over 900. So it's one of the highest in the world and definitely the highest in the Oceania area. My first trip, I was confronted by the stories of women, of so many mothers dying from preventable causes, mostly related to bleeding to death after birth, issues with retained placenta, and overwhelming sepsis. So many mothers were dying within about 2 weeks following giving birth. The woman also highlighted the fact that they were having between 6 and 12 babies each with no access to family planning. The neonatal death rate is also really high, between 80 and 100 per 1,000. And again, many of these deaths are avoidable and preventable with the right care. One of the main issues is access to care, and even if there is a health centre, often it's closed, often the health workers were not available, or they were not providing quality care. When I looked at the literature around training of village birth attendants back in 2011, as I was preparing for my first trip, there was a lot of comment about that it was not useful and that it did not improve the outcomes for mothers or babies. But certainly when I was out there, if you don't have trained village birth attendants, if you don't have health services, then what do you have? And so developed my real passion to ensure that these women in really remote areas where there is just simply so many obstacles for them accessing quality health care, they need to have well-trained village birth attendants or traditional birth attendants so that at least they have some care and they've got some understanding of what is happening during pregnancy and birth and how to identify danger signs and to identify issues so that they can start the journey to try and get some help a lot sooner than what they actually were. I could also really see that the traditional birth attendants, they are the eyes and the ears in their communities. If you are wanting to give birth, even here in Australia, you want to be with someone that you really know and trust. And the village birth attendants were women that the locals knew and trusted. They had elected them to help care for them.
I'm helping planting mama, na helping me platu. Planting mama work lo karim kivini ni lo bus. Now all look at this la, now interest lo. Kam laos karam lo karam. So this like bedding kids you plagi.
After several years of training the village birth attendants, who were doing a marvellous job in saving lives of mothers and babies, it became apparent that we really need to improve the quality of care being provided in the referral hospitals. This is a disused laundry that was being used for women at the local district hospital, giving birth on a piece of cardboard on the ground, which just horrified us. In 2016, we got permission to use the WA Health Department GAWA maternal and newborn care upskilling course, and we conducted that training for the first time to about 26 health workers and nurses from all over the district. Many of them They hadn't had any continuing professional development since they completed their education, which for many of them was 20 to 30 years previously. It is my vision that there will be an amazing supportive system of village birth attendants and qualified health professionals working together to try and improve the health and well-being of mothers and babies in this really remote area. I'm now going to show some footage that I took from a trip last month. I spent 3 weeks in the remote villages of Bunam and Yamen. Well, it's nearly 5 o'clock in the afternoon in Bunam on a Saturday, and we've had a really busy day. You can hear in the background all the chatter. There's still probably about 50, 60 women hanging around waiting to get a contraceptive implant. There's a team of 6 health workers, staff from Midwife Hospital and Angora Hospital, experts in putting in and removing contraceptive implants, and they've been working since 8:30 this morning, non-stop, just constant, doing a fantastic job, really good quality family planning, good counselling, really great service, trying to keep everything as sterile as possible under the difficult conditions, but I've really been impressed by their work. I think one of the great joys for me is I keep asking if they need me to help, and they say no, they're fine. So in the past it's been Living Child that has worked from dawn to dusk with no other help or support. So it's really wonderful to see these health workers really embracing the situation here and putting in their best effort. Really fantastic. An important role of a midwife is to advocate and really to agitate, and that's what I've done a lot of in Papua New Guinea, is to really speak up for the needs of the women, the mothers and the babies. And this is the result. We now have nurses from the ECPIC Provincial Health Authority who are now coming out to these remote areas to lend a hand and to provide the services that are so desperately needed in these remote areas. With regards to the contraceptive implants, the communities have reported back to us that their mothers are healthier and happier because they're not always pregnant. Carol and I have spent quite a bit of time, well, the whole day really, with the village birth attendants. This morning we went through and talked about menstrual hygiene. We talked about danger signs in the postnatal period and really emphasised hygiene, feminine hygiene, especially postnatally. Talked about the other danger signs in the postnatal period. And then we went through breech birth. So last year the VBAs reported to us that they'd had 4 babies die that were breech deliveries. So we found a really good video that just shows breech delivery in the kneeling position, hands free, and have really emphasised to them that this is just for those women where they just arrive and they're in labour and it's a breech. We then taught them how to do an abdominal assessment to find where the head is, and taught that when the head is up, so up in the belly and it's not down in the pelvis, that the woman must go and give birth in the health centre. So that was really good, and the VBAs had a lot of questions. A lot of questions about hygiene, about breech, sharing stories about some of the deliveries that As well as providing training, it's also important to provide some equipment, basic equipment, so that these health workers can do their jobs properly. After 7 years of giving training to village birth attendants and health workers, we are just continually blown away by how they have absorbed the information, put it into practice, and are just hungry for more and more. Yeah, so it looks like tomorrow morning we'll be doing some more implants, so some Sunday morning, and then heading off to the next village. It gives us great joy when we meet women like this. This is Inith, and she came and saw us in the really remote village last month to tell us that she had travelled all the way down to the health centre and had safely given birth to her baby, and now she was coming to get a contraceptive implant. And this is how it should be for these women in these really remote areas and these babies, is that they should be given every chance to survive and supported in their decisions. So that's what gives me great joy. I'm dedicated to midwifery education because I believe that when we have well qualified midwives who are confident in their knowledge, their skills and their abilities, then this is when we start to see the best outcomes for mothers and babies. We need to look after each other as health professionals, and we also need to look out for women